Parenting styles, which one has the best outcomes? Parenting styles play a crucial role in shaping a child's development and well-being. There are 4 important aspects of parenting that influence a child's upbringing: disciplinary strategies, warmth and nurturance, communication styles, and expectations of maturity and control. There are 4 main parenting styles: authoritarian, authoritative, permissive, and uninvolved. Each style has its own unique characteristics and impacts on children. However, authoritative parenting is widely considered the best approach, as it balances high expectations with warmth and support. Authoritarian parenting is characterized by strict rules and high expectations. Parents with this style expect obedience without providing explanations. They may use punishment as a means of discipline. While children of authoritarian parents may be obedient and proficient, they often struggle with happiness, social competence, and self-esteem. The lack of flexibility and communication can lead to conflict and frustration, particularly during the teenage years. Authoritative parenting combines rules and guidelines with responsiveness and flexibility. These parents set clear expectations, but are also willing to listen to their children's questions and provide explanations. They nurture and forgive their children when they fail to meet expectations, using supportive disciplinary methods. This parenting style encourages independence, self-control, and self-regulation in children. Authoritative parents want their children to be assertive and socially responsible, fostering open communication and teaching them how to self-regulate and cooperate. Uninvolved parenting is characterized by low responsiveness, few demands, and little communication. While these parents may fulfill their child's basic needs, they are generally detached and disengaged from their child's life. In extreme cases, they may neglect or reject their child's needs. Children raised by uninvolved parents tend to lack self-control, have low self-esteem, and exhibit lower competence compared to their peers. Permissive parenting is characterized by few demands and low control. These parents are lenient and indulgent, often allowing their children to do as they please without setting clear boundaries. Children raised by permissive parents may struggle with self-regulation, have difficulty with authority figures, and perform poorly in school. Research suggests that certain parenting styles may be associated with a higher likelihood of children experiencing adverse childhood experiences, ACEs. ACEs refer to potentially traumatic events that occur during childhood, such as abuse, neglect, household dysfunction, or witnessing violence. While it's important to note that parenting styles alone do not determine ACEs, certain styles have been found to have a higher correlation with ACEs. Authoritarian parenting is characterized by strict rules and high expectations, with little room for flexibility or negotiation. Parents who adopt this style may rely on harsh discipline methods and have a tendency to be controlling and demanding. The lack of warmth, communication, and responsiveness in this style can contribute to a higher risk of ACEs. Neglectful parenting, also known as uninvolved parenting, is characterized by a lack of emotional involvement, responsiveness, and supervision. Parents who are neglectful may be emotionally distant, fail to meet their child's basic needs, and provide minimal guidance or support. The lack of attention and care in this parenting style can increase the likelihood of children experiencing ACEs. It's important to remember that the presence of ACEs is influenced by various factors, including socioeconomic status, community environment, and individual circumstances. Parenting styles are just one aspect that can contribute to the risk of ACEs. Additionally, it's worth noting that not all children raised under these parenting styles will experience ACEs, as each child's experience is unique. Regardless of parenting style, it is crucial to prioritize the well-being and safety of children. Creating a nurturing and supportive environment, fostering open communication, and seeking professional help when needed can help mitigate the risk of ACEs and promote a healthy upbringing for children. Authoritarian characteristics, high expectations and strict rules, little room for negotiation or discussion, punishment-oriented discipline, and limited warmth and emotional support. Psychological and behavioral outcomes in children: obedience and conformity, lower self-esteem and self-confidence, increased likelihood of anxiety and depression, difficulty in social interactions and forming relationships, and externalizing behaviors such as aggression or rebellion. Psychological and behavioral outcomes in adults: tendency to be more authoritarian in their own parenting, struggles with autonomy and decision-making, difficulty expressing emotions and forming intimate relationships, perfectionistic tendencies, higher levels of stress and anxiety, drug and alcohol use, and delinquency. Impact on mental health: decreased overall well-being and life satisfaction, higher levels of stress and internalizing behaviors, and increased risk of developing mental health disorders, such as anxiety and depression. Parent-child relationship, power struggles and conflicts, limited communication and emotional connection, lack of trust and understanding, increased likelihood of parent-child detachment or rebellion, and difficulty in building a secure attachment bond. Authoritative characteristics, clear expectations and rules with room for negotiation, supportive and responsive parenting, encourages independence and self-regulation, and uses positive discipline strategies. Psychological and behavioral outcomes in children, high self-esteem and self-confidence, better emotional regulation and social competence, improved academic performance, strong interpersonal skills and problem-solving abilities, and higher levels of overall well-being and happiness. Psychological and behavioral outcomes in adults, healthy autonomy and decision-making skills, positive self-image and self-worth, strong interpersonal relationships, resilience and adaptability, and lower levels of stress and anxiety. Impact on mental health, lower risk of developing mental health disorders, higher levels of life satisfaction and overall well-being, and better coping skills and emotional regulation. Parent-child relationship, open and effective communication, mutual respect and understanding, trust and emotional connection, healthy boundaries and independence, and strong parent-child attachment and bonding. Permissive characteristics, few demands and low control, lenient and indulgent parenting, relaxed or absent rules and boundaries, and avoids confrontation and conflict. Psychological and behavioral outcomes in children, difficulty with self-regulation and impulse control, entitlement and lack of respect for authority figures, struggles with discipline and following rules, poor academic performance, and increased risk of engaging in risky behaviors. Psychological and behavioral outcomes in adults, difficulty with setting boundaries and self-discipline, lower levels of self-control and self-regulation, challenges in forming healthy relationships, higher likelihood of substance abuse or addiction, lower life satisfaction and overall well-being, impulsive behavior, and egocentric tendencies. Impact on mental health, increased risk of developing behavioral and emotional disorders, higher levels of stress and anxiety, and poor coping skills and emotional regulation. Parent-child relationship, lack of structure and consistency, perceived lack of parental guidance, tendency to view parents as friends rather than authority figures, strained parent-child communication and conflicts, and difficulty in establishing parental authority and respect. Uninvolved characteristics, low responsiveness and involvement, minimal demands or rules, neglectful or indifferent parenting style, and lack of emotional support and guidance. Psychological and behavioral outcomes in children, low self-esteem and self-worth, poor emotional regulation and social skills, academic difficulties and low motivation, higher risk of engaging in delinquent behaviors, and increased likelihood of mental health disorders. Psychological and behavioral outcomes in adults, difficulty forming and maintaining relationships, challenges in managing emotions and self-care, lower levels of life satisfaction and overall well-being, higher rates of substance abuse and addiction, increased risk of mental health disorders such as depression or anxiety, impulsive behavior, delinquency, and drug and alcohol use. Impact on mental health, higher risk of developing mental health disorders, poor emotional well-being and self-esteem, increased vulnerability to stress and adversity, and higher incidence of suicide. There are many other parenting styles such as respectful parenting, gentle parenting, trauma-informed parenting, and many more. Respectful parenting emphasizes treating children with the same respect and dignity bestowed upon adults. It promotes open communication, understanding, and mutual respect between the parent and child. This style encourages children to express their feelings and thoughts freely, fostering a sense of self-confidence and autonomy. Parents who adopt this style often believe that children learn best through guidance rather than punishment. Gentle parenting is a compassionate, understanding, and empathetic approach to raising children. This style places emphasis on building strong, positive connections between the parent and child, instead of relying on traditional discipline strategies. It is about understanding the child's feelings and needs and addressing them in a loving, gentle manner. Both of these styles fall under the umbrella of positive or authoritative parenting, which is characterized by high responsiveness and high expectations. This style is known for being both responsive and demanding, nurturing but firm. Gentle parenting, in particular, has gained significant attention since 2016, following the release of Sarah Ockwell Smith's book on the subject. Yet as these styles are relatively new, there isn't extensive scientific research available to definitively prove the long-term outcomes and benefits in adulthood. In contrast, the four main parenting styles, authoritative, authoritarian, neglectful, and permissive, have undergone decades of research since the 1960s. Numerous long-term peer-reviewed studies and meta-analyses have consistently shown that authoritative parenting tends to produce the best outcomes. While there are other promising parenting styles, such as gentle parenting and trauma-informed parenting, they are relatively new and haven't been studied as extensively. This doesn't mean they're less effective. It just means that we don't have enough data to draw comprehensive conclusions. It's important to remember that there's no one-size-fits-all approach to parenting. Different styles work for different families based on their unique circumstances. The focus on the four main styles in this post is due to the availability of research data, and not a judgment or discrimination against other parenting styles. Each parent is doing their best with the resources they have, and the most effective parenting style is one that nurtures and supports the physical, emotional, and mental well-being of the child. In conclusion, authoritative parenting, characterized by high responsiveness and expectations, is considered the most effective parenting style. It nurtures and supports children's emotional needs while setting clear boundaries and consistently enforcing them. Authoritative parenting promotes independence, self-regulation, social competence, academic success, and positive mental health outcomes for children. By Lena Kravitz.